All right, so I just want to say hi, morning. It's Monday, and I just want to talk with real good today. I'm gonna talk with you real good today. I really do appreciate all the persons that I've been following. Some of you guys haven't followed us yet, and that's because TikTok kinda thinks say me I follow too much person at once, and so then kinda slow me down a little. So just bear with me. But you might realize that one and two of you guys, I do put on your page or in the comment section that me soon come over to your channel or me soon come over to your page and start dig up you. All right, meaning when me say dig up, me coming over there to just kind of browse through and look at your content and see what me find interesting and go ahead and just repost it. And that is what I am going to talk to you regarding today, reposting. When you follow somebody, me personally, not expecting you to be watching all of my content. I would love for you to do that. And I would love for you to go ahead and do everything that algorithm says. Like, comment, repost, share, favorite, all them things there. What them say, start from the bottom up. It works. It definitely works because guess what? Last week I was in the 200s when I started becoming a little bit more engaged when I say engage, me engage with them content. If you're one of those persons that can attest to me coming to your page that I follow and you realize that I repost your video, just go ahead and leave it in the comment box below because I don't want persons to feel as though I'm just saying this. I do engage with persons' content, even if the content is not something that I am interested in. What I do is I find one of your most common viewed, the one that has a lot of comment, one that has a lot of share, I'm gonna go ahead and me share that one as well. Me favorite it, me repost it, me like it and me comment under it. Just because what the algorithm does is it pushes it out to other persons. And even though, yes, I might not like the content or it might not be something that I am interested in 100%, definitely it is benefiting me as well because what is happening is that the algorithm is understanding that me understand what the algorithm wants. You understand? The algorithm realized that me want to get popular on TikTok. All right, not really popular, but more wanting to get my content because I have information that I think will benefit you as a nurse, a student nurse, or the general public. You understand? So definitely, I go onto your page and I go ahead and repost, favorite, I like, and I comment. I make sure that heart button, yes, it becomes red. So we don't need to be only doing that. Find one or two videos on person's page and just interact with that page. It's not going to take you too long. You just watch a video for a few minutes, you go ahead and you do the same thing. Repost, favorite, comment, like, and that's it. You understand? And you will realize that you're helping not only that person, but you're also helping yourself. Because when you repost and do all of those things, people are going to come to your page as well. They're going to see one or two things that you like, and they might do the same thing. So if we get into this habit of doing that, you will realize that everybody win on TikTok. TikTok is about, a win-win situation right about now. That's how I see it. You understand? You win, me win. If you follow me, me follow you back. If you peep, me go and peep too. And if you not do not, me not do not neither. You understand? Except sometimes, definitely, if the content interests me, me go peep and me go follow you. That's just life. All right. But definitely go ahead and get into the habit of doing that. I am at 900 plus, followers. So over 700 followers I've gotten over the last, 4 days or 5 days, and that is pretty impressive. So definitely keep on posting, definitely go ahead and interact. As I say, even if it is one video, do the same thing that the algorithm talks about. Do the same thing that everybody say. Oh, go ahead and start from the bottom up. Yeah, me do one video about that and never really make no sense. Let's see if this will help as well. But definitely, I really see where there is interaction going on my page, and I do see where my followers are increasing. And as me say, you follow me, me follow you back. And even though I might not follow you as yet, we're going to come back and do it once I am able to do so. Because as me say, TikTok realized that me a follow back a whole heap of and kind of slow me down a little. So this morning I was able to follow up to 20 persons or 25 persons thereabout, and then I get the little notification to say that I'm sending in too much request. So I'm just gonna refresh my page again later on in the day and see how many persons I can do that to. But definitely, let me know. As I say, if me follow you and you realize that I have been reposting, sharing, commenting, favoriting, and all them things there, just go ahead and drop a comment down the bottom so persons can really know that I'm one of the persons that come onto your page and fast, be inquisitive, see what content you have out there and see what me can push out for you. All right. And that's what I want each person to do. Each one reach one. And that's what TikTok is all about. You understand? Everybody want to kind of get some little income coming in. Some persons want to retire from them regular 9 to 5. Some persons just want to do content creation full time. Definitely help them. Some persons just want to promote a product. Help them. Some persons just want to promote a lifestyle. Help them. That's all we're doing. You understand? Help them. So definitely I would encourage persons to start from the bottom up. Go ahead, favorite, repost, comment, like, make sure that heart, it, gets red and cute, and just leave something nice for the people. You understand? Even if it don't make any sense to you, just leave something nice. A few hearts, a few words, something. Keep up the good work, whatever it is. So I never cancel a visit. I never cancel a visit, It's because I'm already there. I just went ahead and did a virtual visit from the home. A lot of times I have to do that. And that is considered a full visit just the same. So rather than leaving, because I'm already there in the man's house. You understand? So I just went ahead and deferred the exam, the vital signs, anything to do with touching the patient. And just make a documentation of what I am seeing in the house. Exactly as how me say it. That's how it go. You understand? I didn't even tell you that the gentleman's bed, the leg of the bed, basically they already broke down. Because the foot of the bed literally was like this, the ones at the front. You understand? So definitely when I go in for house call and I observe the environment, if I don't think I am prepared, especially if I don't have a gown or anything like that, definitely. And I think I need a gown. In his situation, I definitely would have, benefited from a gown. I never have a gown, so there's no way I'm going to be going there leaning over onto the patient. And people don't understand that, it's not necessarily say you're scorning people, because a lot of times I see nurses in the hospital, they're doing it. And for me, no, it don't make sense me I walk around in the hospital or walking around in my car, doing this house visit and smelling like puke or vomit or smelling like poop or just being dirty because of contact with patient. No, presentation is key, and so when I go out there, I still have to look good. You understand? So definitely, I just go ahead and turn it into a virtual visit and get my full visit for a home visit. Because in house call settings, you have virtual visits and you also have in-person visit, and the rates are different. But me already drive along the money, so guess what? They're gonna have to compensate me for the full visit. You understand? So I definitely just documented that it was a home visit, but I deferred the exam findings because of the fact that, this is what the situation is. So definitely, I never plan on go back to that house. Once I see it on my schedule, I just tell them no, they're gonna have to find somebody else, because I did put in that he needs to go into a facility that deals with morbidly obese patients. But with insurance and everything, it's a struggle, but that's about it. So I just went in to see a patient, and it's a 57-year-old female. She's disabled, she's nonverbal, and she lives with her parents, mother and father. And they're in their 70s. They look like they're in their 70s, probably heading into 80s, but they're both ambulatory. There was something that was off with the evaluation, the mere fact that the wife or the mother was not in the room at the time. So anyways, I was there. The husband said that he was concerned about his daughter having a lot of pain because she's always groaning. She has a decubitus ulcer, or ulcer to the bottom, and every time it's being dressed, then she is actually crying, screaming. So he's asking for something for pain. He says he's using Tylenol, but he wants something stronger for pain. So I said to him that yes, she would definitely benefit from something a little bit stronger than Tylenol. You understand? Because especially with the fact that she's nonverbal, you're not really able to tell. So at least to make her comfortable, this is what we can offer her. I don't have a problem prescribing narcotics, for her, given her situation. So the husband turned to me and said that, that I was thinking the same thing, but my wife says that she doesn't want her to be on any narcotic. She doesn't want her to be on anything stronger. So I said to him that, honestly, I don't know how to help you, because if your wife, had a discussion already with the pain management specialist and refusing for that, I don't know what else to do for, for the patient, because they never did go through with the pain management care. You understand? They refused it. So I just said to him, it's up to you guys. You understand? At the end of the day, you need to remember to take the patient or your daughter needs into consideration. And if you as the father feels as though she is having a lot of pain, you have to make that strong decision and request the pain medication. So while we were in the room and talking, the wife came in and I explained to her the different options. She's like, no, we're not doing this. We're not doing this. We're only doing the Tylenol or the Motrin. So I said, well, that's going to be a decision between you both. You understand? You can decide whether or not you want the narcotic, but this is what I'm going to do. Because I feel as though the patient needs something a little bit stronger than Tylenol, I'm going to send a prescription to the pharmacy regarding Tylenol with codeine as you've requested, Dad. And so after you guys finish talking it over, shouting at each other, then you can decide whether or not you will go and pick up the prescription or not. You understand? But for now, I'm going to send you a 30-day supply of medication. It's at the pharmacy. While I'm there telling them all of this, they're on top of their voice, screaming at each other. Some of them say, excuse me, this is the situation. The prescription is at the pharmacy. Whenever you're finished arguing, then you can decide whether or not you go and get the medication. But this is not something that I can get involved in anymore. You understand? This is the first time I'm meeting these folks. And this is what the situation is at home regarding pain medication. So I just go ahead and send the prescription and just walk out of the people in the house while they're there arguing. Like, I don't know what else to do because I'm there talking and they're there back and forth arguing with each other. So the caregiver, when I was leaving, she's like, yeah, you're not the first one that comes here and this is the situation. So I don't know if I did something wrong with sending the prescription, but they never had any prescriptions out. They never got any prescription drug for, any narcotic out. So I say, okay, then they don't have to take it. You understand? The prescription is at the pharmacy because I feel as though the patient would benefit from it. And the dad feels as though the patient would benefit from it. So in the end, if they come to a conclusion or an agreement that they will try the Tylenol 3, the prescription is there. So let me know what your take on this is. But sometimes I do realize that a lot of our patients that are disabled, in as much as they're in the care of their parents, sometimes they're not getting the best care. So they always say that nurses, doctors, caregivers don't take care of patients. So we need to definitely look at sometimes the relatives as well, because not all the time the patient's needs are being addressed. You understand? Because in this situation, there is tension in that house regarding narcotics. I don't know why, and me never stick around too long to find out. You understand? But go ahead and share your thought on the topic here and let me know what you would have done under this situation. Alright, and check out more videos. Remember to go ahead and subscribe to my YouTube page where I share longer form content. Just go ahead and check out my YouTube page regarding everything regarding nursing, travel, lifestyle. I'll be talking with a few nurses. So if you're one of those nurses who have stories that you want to definitely share, feel free to go ahead and link me up, send me a message, and I will get back to you. Alright, until then, I will see you in the next video. Bye. So I went in to see my patient, and as I say, I do house call visits. And of all the patients I would think that would understand the importance of a mask for, persons who are entering their homes, a lot of them don't understand. So a patient get upset with me because I am coming into their home with a glove and a mask. I don't know if I am wrong for doing that, for wearing it, but the amount of things that are out there, I don't think anybody should be upset at nurses or healthcare workers coming into their home wearing a mask and a glove. Just like when you're at the hospital, what's the difference with me wearing my glove in your home? Like, a lot of these places, they're honestly not clean. They're not clean. So why is it that we're getting so upset with healthcare workers coming into your home wearing a mask? At least I would feel comfortable if I see somebody coming into my house with a mask, because then I would be like, oh, you're protecting yourself against my family and you're protecting me as well, because you don't know whether or not I have something that can be transmitted. I find it wrong for healthcare workers to be going into patients' home, doing house call visits, with a glove or with a mask for persons who prefer to do it. And if it is something that you definitely do as a nurse or a caregiver, let me know as well in the comment section, because I'm very curious. Thank God for COVID-19 in a sense, because a lot of these places, if COVID-19 didn't hit, may I tell you, say, a lot of us caregivers would have dead in some of them people in your house. You understand? So I like the fact that we have the mask at our disposal, where we can go ahead and see the patients a little bit more comfortable than if there wasn't any mask. You understand? So I honestly don't know. The gentleman was like literally upset that I am stepping into his house with a mask and a glove. This is just the life of a nurse practitioner. This is just the life of a house call nurse practitioner. You understand? There is so many things that are going on out there that, may I tell you, say, you have to be very, 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 very strong to do this kind of work. I said to him, it's either. You understand? You need pain medication, you need refill. It's either going to allow me to see you or you allow me to go. But otherwise, I'm going to be keeping on my mask and my glove when I come in to see these patients. That's just my standard. So let me know what you think on this matter. All right, bye. All right, so thank you so much, Nurses Notes, for asking this question. Are you the first nurse to go there? No. Did you have a history to review to see if the patient case can be taken on by myself, basically? And I would say I did review the notes, but if you know, a lot of times we document things and the documentation is not clear, and your channel is Nurses Notes, so obviously there is something that you're bringing across in terms of with Nurses Notes that people need to get understanding of. And I realize that a lot of times, especially in house call here, in house call service, because it's a case where I feel as though a lot of persons are probably just there for the money sometimes. We don't spend the time and document as much as we possibly can because you're just saying, oh, I'm just going to see this patient one time or two times and that's it. Copy and paste things. A lot of people don't review what they're copying and pasting, and they don't make the necessary adjustments to reflect the patient status. I noticed as well that there wasn't any consistency with that patient because it was more of a televisit. They did a lot of televisit, but I'm the kind of person who loves to go in and see the patient. So even if I go in and the patient's home is in a total mess and I feel as though I am not going to go back there, I love the comfort of knowing that when I document on a patient, it is a true reflection of what the patient is. Because at least in the end, I can always say, this is who I saw based on the notes, because later on, we might not remember anything about the patient, you understand? And I just have to rely on my notes itself. So definitely, I always review my patient's notes, but as I say, there are certain things that are not documented. And as nurses, we need to get into the habit of doing this, because if we don't do it, we're not going to be able to protect ourselves. We're not going to be able to protect other persons, because key information such as, how the patient, appears in the house or the home environment itself, safety hazards that need to be highlighted were missing from that chart. Because when I go in and see a patient, for example, if I notice that there's a pew, that's what we're calling it now. We notice that there's a pew, I'm going to make a little notation of the fact that there was a little pew and why I feel it's unsafe for me personally if I am not going to go back there. Or I'll just make note of those things on the chart. So as soon as you open the chart, so you see pop up to say their dogs, their cats, there's a pew, there is, the gentleman is just aggressive, argumentative or anything like that. So you go there, this might happen because of, previous experience. So it's very important as nurses to make sure that we review the notes before we're going to see these patients. Anything that is very pertinent, go ahead and highlight it, leave it in the notes section, and make sure we're documenting things that we see in the environment. Every single thing that you document goes together to make this assessment for the patient. And it's not only for the patient, but you're also helping yourself as well as other colleagues that are going to be coming along with you after you visited. And that is a very good point, because as I say, that is something that I've noticed that a lot of persons tend to do, because sometimes you might see it's a patient that is a male and you might see a representation of a female notes. You understand? Talking about a transgender here. We're talking about the fact that we don't sit down, and even if we're copying and pasting, we don't sit down and take the time out to say, okay, then let me review it and make it be reflective of the patient. And that was just a situation with this one, along with the fact that there hasn't been any visits after for a long time. Some of these patients in house call service, they haven't seen a nurse practitioner or a provider, let's just say, for a long time. And you don't have, depending on the company that you're working with, sometimes you don't have that consistency with home health providing update to the company. So when you as a nurse practitioner go out there for the first time, you're being greeted with different things that you probably didn't want to, see or visit or be a part of. But for me, if I'm already there and if it is safe, Yes, there was a pew pew. If it is safe, I will definitely go ahead and just finish up the assessment and just step out. You understand? And don't make it be something that I discuss with the patient. Because, sometimes it can become very argumentative when you start talking about, oh, the need to put away this. But definitely, those are things that we need to definitely think about when we're doing house call service. Make sure that, whatever you document is a reflection of the patient and it protects you as well as other persons that are going in the home to provide the service for these patients. All right, bye. All right, so Jess Simmons, that's why I can't do home health. If it isn't the patient, their family, unhygienic homes, bed bugs, wild pets. Okay, so definitely, Jess, those are things that are right across the board that you have to deal with in house call setting, as well as in the emergency room for me at the time. Not so much the pets, but definitely the bed bugs, the lice, the family and the patient. Those are, issues that we tend to find ourselves dealing with a lot of times in the emergency room. And the only thing that I wasn't comfortable with at the time is like the animals in the home. You understand? Oh, with that being said, I went in with an open mind, knowing that there are gonna be tons of different things that I'm gonna be exposed to because of my experience with emergency room nursing. Because especially when I moved here to the state, there were so many things in the environment that or the conditions that I would be seeing in the emergency room that I am not accustomed to. And when I see it for the first time in the emergency room, I say, Lord have mercy, I never know see them things here can go on. You understand? But as I get, accustomed to working in the States here and seeing that this is almost like an everyday thing. People come in with bed bug, lice, their conditions are just in a real bad situation. You understand? And I've now decided that let me just transition into home health to see what it is at the time. I was doing that part-time. And then I realized that there's a bigger problem out there. There is so much more of a bigger problem out there. And I wanted to kind of just step away from emergency room nursing and just go into the homes of these people, hear what their situation is, and try to see if I can advocate for them. I want it to be a situation where now I'm a nurse practitioner, I can go out there and advocate a little bit better for these patients because I'm using everything in their home environment to help with making sure that their needs are met. And so when I go out there, as I say, there are so many things out there, but I just have to go out there and be prepared. When I talk about prepared, I'm talking about, the clothes that I'm wearing, the shoes that I'm wearing, making sure that I read ahead on my patients. So that way, when I get there, I can just stand as a statue, get information if I need to, and just go out and put in the best note or put in the best orders that I think is suitable for the patient. Go ahead and make the best call. Go ahead and make the calls that I need to do to get these patients out of that environment. And yes, as I say, a lot of times it's depressing, it is sad, but I feel good with the work that I'm putting in. So regardless of, yes, there are bed bugs there, the thing about it is that because I'm not bend over on anybody, because I am thinking about all of those cases that I've been experiencing over the past couple of years in the emergency room, I go with a very open mind and I go with a plan. Me go with a plan. You understand? There's not a day that I go in to see a patient and I am not thinking about the exit, the exit route for that patient. In as much as this patient, yes, had a pew pew, that's what we're saying, he had a pew pew. The pew pew wasn't identified until in the latter part when I was trying to get the vital signs, because I tried to go ahead and talk with my patient, hear what's going on before me touch the patient. You understand? So it was at the latter part I realized that, over that side when he said I can do the blood pressure on this arm, I realized that he was putting down the pew pew. So definitely I go ahead with an open mind. I'm observing my environment, I'm assessing my patient, and I make sure that whatever I put in my notes is adequate information, that insurance, if they do have insurance, can go ahead and pay for these things to help the patient. Because if you don't go in and do a thorough assessment, if you don't go in and listen to these patients, hear their concerns, make your decision, you go ahead and diagnose the patient, a lot of these patients are just going to be there. So that's just me. I go in with an open mind. I care about my patient. And anybody will tell you from emergency room days, that's just me. When we go in and see a patient, me I take care of the patient. You understand? I'm not backing down. Me I take care of the patient. The patient could be a hot mess. That is just me. Same mentality I have when I go in to see these patients. In as much as probably it is a total hot mess, I am there already, and that is what me say. Me already there, so I'm just going to go ahead and do what I need to do. Me go ahead and just do what I need to do, and then me can always hand off the patient and call it a day. But me not gonna really run from the home environment, because if me run, everybody else will come after the run. So because I'm already there, I just spend the time, take the information that I need, assess the patient, put in my diagnosis, send out my orders, advocate as much as possible. If it means somebody, if you call the fire department, if you get this patient to the hospital because we can't get the patient out of the house, if it means I'm going to call the ambulance, if it means I'm going to call adult protective services, if it means I'm going to call pest control, me I going to do it for the patient because this is what the patient needs at that time. And even if 1 out of 10 of the orders that I do implement for those patients do get, done, me feel good within myself. You understand? So yes, I understand not everybody is built for this. I'm not here to bash anybody who don't want to take the time out, but not everybody is built for this. And as I say, I have a foundation in emergency room nursing, and when I go out there, I just go ahead and just give it my best because that's all I can give. That's all I can give at that time for that patient. And so I will just spend my time there. As long as I'm not bringing home anything extra with me good. Because as I say, I go with a plan in mind. And if you haven't seen where I talk about things that I walk with on my visits, the only thing that is missing is like probably a gown. I'm not really going to buy a gown because the time hot. I'm not really doing any procedures. So when I go there, the only thing I do is, do their vitals, talk with them, hear what's going on, and that's it. Do their assessment. So definitely that's the only thing that is missing. But otherwise, if it means that I'm gonna have to get a water boat, I'm probably going to get a water boat so I can put my pants foot down in it and call it a day. But then again, I'm wearing, those pencil scrubs, so there is nothing that is hanging on these patients' floor or brushing against anything. So I'm pretty good with that. And that being said, yeah, here I am. It's depressing, as I say a lot of times, but I'm happy with the work that I'm doing. And this page is just to provide awareness and make sure that as nurses, nurse practitioners, we go out there, we're trying to learn from other persons' mistake or what persons are doing to help with their patients, to make sure that their patients are a little bit more comfortable, because sometimes we might have relatives who are not, helping out the patient, and sometimes the patients are just relying on you. They're relying on me to just come and visit them to say, okay, then this is what they need and this is what you can do for the patient. So for me, yeah, I find satisfaction and I find it rewarding to go out and see these patients, even though, yes, it might not pay that much for the amount of work that I am doing, honestly, but, it still pays. I'm covering my bills and I'm excited about it. But definitely go onto my YouTube page and be a part of the family, because eventually we're going to need people like you and you to be a part of my charity, as well as my community outreach program that I am implementing. And the channel is Think Nursing. It's one word, so just go over there and subscribe to the channel and be an active part of the channel. All right, until then, I will see you in the next video. Bye. Right, so when you're preparing to go and see a patient, whether in house call or even when I was working in the emergency room, one thing I normally do is try to go through the patient medical history, get a brief idea of what's happening with the patient. The last thing you want is to show up to a patient's house and then be asking them all the information that has been documented by multiple providers in the chart. Nothing is wrong with asking them about their diabetes and how that is going, but sometimes you don't want to go there and then it frustrates them when they have to go through and explain everything with you. So definitely, even if it's the first time you're seeing the patient, just take the time out from the night before, go through prep, write down certain things that probably you want to address at the visit. Go ahead and write down the lab values so you can go there and discuss. And the more information you know about the patient, it makes the evaluation a little bit easier for you as well as for the patient, because as I say, patients can get frustrated just by repeating themselves over and over to Tom, Dick and Harry every time they come there. And especially with house call visit, because you have that high turnover sometimes. Just imagine a provider comes today to see the patient, next month is a different provider. The patient has to go through that. So just try to put yourself in the patient's shoe and read up on your patient from before, so that way you can be familiar with the patient when you get in there, and it makes your visit a little bit easier and the rapport is better for you and the patient. And then from there, that's just it. I have a patient just now who, she has had a provider for the last couple of years. There's been providers switching every now and again, and no, I am here. So she's a little bit frustrated, but she's willing to work with me. But I kind of explained to her that this is what house call service is about. Sometimes persons might come, they leave, and so you always tend to have a high turnover rate when it comes on to certain providers working certain practice. So definitely make sure when you get there, your patients are comfortable with you and you build a rapport, you build a relationship with your patient, so that way they're not frustrated. You understand?